right, beautiful people. Welcome to the Afternoon Jams. Joining us today, Michael Pine from Healthwest, the boss man over there at Healthwest. How you doing today, Mike?
I don't know if I'm the boss, but I'm doing okay, Paul.
You're doing boss type work, though. You know what I mean?
Let's hope.
And you want to introduce the community to someone who's working very hard.
I do. For the longest time, Paul, we've talked many years now. I think about 8 years. I've chaired and co-chaired the Suicide Prevention Coalition of Muskegon County. And over the course of the past year or so, we've had a transition here. I'm transitioning. I still participate in the Suicide Prevention Coalition.
Okay.
And I'm turning my focus and my attention on things within Healthwest to hopefully prevent suicide, as well as I'm associated with some other statewide groups that I'm going to stay connected to as well. But I have stepped down from chairing the Suicide Prevention Coalition, as is Scott Tishmer, who used to co-chair with me. And today I want to introduce to you Ryan. And Ryan Westerhouse is going to be co-chairing the Suicide Prevention Coalition of Muskegon County with Jenna LaMadeleine. So today we have Ryan with us.
Welcome, Ryan. How you doing?
I'm doing well. Thanks for having me, guys.
Good. Huge task for you. How are we looking on suicide in the last couple of years?
Here's how this kind of breaks down. Over the course of COVID, we knew from the research and all of the data that the suicide rates would likely decrease during COVID. And in fact, they did in the country. They decreased. Here in Muskegon County, our numbers went down in 2019 and they were up a little bit in 2020. Whereas the rest of the country dropped, we saw a little increase. But while the numbers, for the first time across the country, they came down. It's been like 30 years since we've seen a decrease in suicide. So it was pretty amazing to see the numbers drop nationwide. However, nationwide, the one group where the suicide rate continued to increase in is the African American community. It was the only group where we saw suicide increase. Wow. So it's never good news. Like, you want to say, hey, the suicide rate decreased, but we're still losing people. It's still the 10th leading cause of death for Americans, and it's the second leading cause of death for people who are between like 10 and 37 years old. Second leading cause of death. So it's still a huge problem, Paul, and it's a growing problem in the African American.
Wow. Ryan, what do you plan to do as on this task force?
So over the past 8 months that Michael and I have kind of been continuing to touch base, I think we have a couple of things scheduled coming up here in September that I'll touch on here soon. But the creation of the strategic plan that we've been doing is something that I think we'll be really proud of once we get everybody together. We're focusing a lot out of our efforts are focused on the September event we have coming up. But then we'll get back to grinding on the strategic plan that we have created, doing some more things, continuing to grow, especially growing into the African-American communities, as Michael has touched on. We have some speakers coming up here that are hopefully going to help us assist in continuously working towards building those relationships within the communities.
Mike, what do you think is the reason why you're seeing an increase in the African-American community?
Yeah, this is always the question. And, I've participated in a lot of conferences. I've gone to a lot of conventions. I think this year is the 56th annual or the 56th annual National Conference on Suicide Prevention, 56th or 57th year. And as I mentioned, the suicide rate's been increasing for 35 years here, right? So it's really hard. I'm not a very big brain. I'm not really one of the smart scientists or anything that are out there coming to these things, but it's hard for me to go to something like a National Suicide Prevention Conference and over, 30 years, the rate has done nothing but grow. And the question is always why, right? Why? And then when we see a decrease, but we see an increase in suicides within a specific community like the African American community, to some extent, the Native American community has also got its own struggles. But my thoughts on it are going to be sort of my opinion here. Okay, I'm going to throw this out there. I think that historically, even going back to the slave trade days, you can look at the African American community and they were there for each other, supportive of each other, would come around each other when there were issues, concerns, and problems. This started to kind of disintegrate with the white community or the non African American communities. this started to kind of fall apart around the 40s and 50s, right? Now you could get a job, you could have your own apartment away from mom and dad. We weren't necessarily, we've raised our families differently. And I think there's been different approaches to healthcare. Now, I'm not dogging on the white community at all here, but what we have is a situation, I think, now where what we know works is when communities and families come around an individual who is unwell with depression, anxiety, mental health concerns, physical health concerns, when somebody's bringing a plate, when the church is supporting somebody who's in a hospital after a surgery. And I think we're starting to see those changes starting to affect the African American community, where maybe there's a little less support around folks. And again, this is just my opinion, and I could be totally wrong, and I'm more than willing to discuss and debate that. My fear, I guess, is that the supportive community that had been there, we're starting to see it ebb away. When you compare suicide in the African American community, the Latinx community, the Native American community, those in the white community, it's still dramatically higher than in the African American community or the other communities. What's alarming, though, is we're starting to see people having serious thoughts of suicide in the African American community that are slightly higher than in the white community. Seriously considering suicide and making a plan or making an attempt, slightly higher in the African American community than the non-African American communities. And I don't know what is actually behind all of that, but it is truly disturbing because when you get down to who's actually dying by suicide, fewer people in the African American community than in the white community. But if we're starting to survey people and we're hearing that the thoughts of suicide are increasing, seriously planning suicide and then having an attempt are slightly higher in the African American community than the white community, this is a bad predicament. And I know you and I, Paul, have talked about this for the past 5 or 6 years. And sure enough, it's following just what the trends were telling us. It's starting to reach a point where it's out of control. My call is always for all communities, come around people when they're struggling. Don't shy away from mental health concerns. Be there for folks.
We've got an online question. This is from Dwayne Harris. How could I help with this suicide prevention thing? Good question.
There's a few ways that you can help. First of all, I would recommend that minimally you take a class about how you can help on suicide prevention. We offer QPR. I know Paul has been promoting our QPR classes. QPR is question, persuade, refer. It takes about an hour. If you Google Healthwest, all one word, Healthwest, Eventbrite, you're going to come to our page. We have free classes on there where you can learn how to help somebody who's having thoughts of suicide. But the way we can really help each other without necessarily getting down to the nitty-gritty tools of how to assist is, one, be supportive of each other out there. We live in a very divided world right now. A lot of bullying going on with adults, let alone children. We live with a lot of negativity that's out there currently. We just got to be supportive of each other. We got to know that we've got each other's back and we're there. But then learn those technical skills. Don't be afraid to ask the question, are you having thoughts of suicide? Don't shy away from that. And when somebody answers yes to that question, you got to let them know, I'm here with you. I want you to be here tomorrow. Let's get you to the help that you need. And you can always, always call Healthwest, regardless of ability to pay, regardless of insurance. If you have the Cadillac of insurance, you can still call us and we're going to help. I can get you that number, Paul, and we can talk about it.
Dwayne says, are there any classes available? And maybe Ryan, one of y'all can get that number. We can post that number too. Any classes that are available for suicide prevention?
We have classes right now coming up this month. We have at least 4 classes. We have one QPR, question, persuade, refer. QPR class is being offered for veterans and their families. We have 2 other classes that are just open to the community. You can do it online, so you don't have to even worry about coming in. They are free. And then we have another class that we are offering for individuals who speak Spanish. So we have a QPR class coming up in Spanish as well, reaching out to that Latinx community too.
Wow. Ryan, why do you think this higher increase in among the African American community? What are your thoughts on this? Of course, we got Michael's opinion, and Michael been around a long time, but you're a newer guy. So what have you seen?
Sure. I mean, to be honest with you, that's a debatable question that we could have for years. But to be honest with you, I think it involves around the difference of communities. I think there's a separation in communities, even in the localized block to block these days. It's just sometimes when we see the units or different blocks in different areas of the communities that maybe don't necessarily get along with each other that once did. So that the lack of camaraderie there is becoming an issue within some of the areas, I think. But I think we're seeing that not just in the African American communities. I think we're seeing that everywhere. The access to social media, the divides, the fears. I think there's a lot of fear that we see all over the news. Whether you watch whatever news channel you tune into, it's a lot of the fear of the unknown. And I think with there's certain things like this, like with the COVID stuff going around, we continue to see the fear grow, and that's what seems to be.
Everything's bad. Everything's bad. We're all gonna die real soon, and whew,
Absolutely.
crazy. It's crazy. Um, um, tell us about your event that you have coming up.
Ryan, you want to, tell them about the event.
Sure, absolutely. So the event we have coming up, it's an annual thing, and typically the event is held at Hackley Park in Muskegon here. However, this year we decided to err on the side of caution due to COVID and other things. We decided to do a virtual event this year. The event is actually coming up this month due to September being Suicide Prevention Month. We are going to hold the event on September 2nd, or excuse me, September 22nd. That is a Wednesday, September 22nd at 6 p.m. And there's several ways that you can get involved in that. However, the easiest way to sign up for the event is you can go to our social media page, Muskegon Suicide Prevention Coalition, and you'll see advertisements for it's there. But the easiest way that I feel to get involved, and I'm really hoping that we can get as many people to the table as possible, is you go to suicideremembrance.eventbrite.com. That again is suicideremembrance.eventbrite.com. If you can't write that down, the easiest way to do it was just simply go to eventbrite.com, type in suicide remembrance, and that'll be the very first one in the search bar that pops up. The event again is September 22nd at 6 p.m. It is a free event to all. I want to stress the fact that it is free. You register on Eventbrite just simply so we can kind of get a number on how many people are going to be there. But it is a 100% free event for everyone, whether you have lived experience with suicide, whether you've lost a loved one to suicide, whether you're suffering with suicidal ideations yourself, or whether you're just interested in how to get involved. We really want everyone to come to the table here, and it's a learning experience. It's a stigma crushing experience to try to get everybody here to feel comfortable with using the word suicide, with feeling comfortable with in your communities talking with one another, and this will give you some ideas on how to reach out to your loved ones to do so.
Well, question: we're hearing about these overdoses with fentanyl. Are these considered suicides?
Just yesterday, Paul, I was having this conversation internally here with some of our teams, right, that are working on data and data collection. And we were looking at some deaths that have occurred, trying to figure out just how many people have actually died by suicide in the community and just how many people have died by suicide that we serve here from Healthwest. And looking at these overdoses, it's one of those things that if the medical examiner doesn't have concrete evidence that it's a suicide, they can't call it a suicide. So it's really a tricky one. It's really hard to say. Now, a lot of times people with addiction, they don't want to die. They don't want to have most people who have an addiction don't want to have an addiction, but they don't necessarily want to die. That doesn't mean that people can't become despondent and maybe think, I don't care if I wake up tomorrow. Right. There's also the risks. Sometimes really powerful fentanyls out there, or a really bad batch of heroin will go around and we'll hear about people dying. But it's hard to call them suicide. It's if the medical examiner doesn't call it a suicide, we don't call it a suicide. But you can also rest assured, with suicide being the 10th leading cause of death in America, that's about 48,000, 47,000 people a year who die. And what we know from medical examiner surveys across the country is that number is probably double, because people do hide their suicide, right? Single person car crashes, drug overdoses, and it's hard to know. It's another answer.
When I travel to Africa, which I do a lot, these are poor countries economically. And when I tell them about the suicide and some of the drug things that we're dealing with here in America, they're shocked.
Right.
They're shocked because they're stressed out. They want to make, the average income of some of these places is only $1,200 a year. What is it about America that drives this suicide and this excessive drug use and all these other things that we don't necessarily see in poor countries?
That's a good question. I've asked that question for years, right? What about people who are in truly stressful situations, who live a lot closer to death than we do, right?
No
So
running water.
no water. The risk of parasites and other infections that can take your life so quickly and easily, and yet they have a lower suicide rate than us many times. And that there are communities in Europe as well, right? There are communities in Europe that do really, really well. And I think a lot of it, I don't know, this is really tricky. I think some of it is here in America, you got to plan. You got to achieve. You got to consume. You got to have the best car. You got to have a big house. You got to have money in your bank account. There's all kinds of stresses and pressures that we do put on ourselves and we put on each other that I think sometimes when you visit other communities, it's like, why do you plan so much? How come you just can't let things kind of be? And I think that at least here in this country, the reason it's probably the 10th leading cause of death, second leading cause of death for young people under the age of 40, is I think these pressures. And also we're disconnected from each other. We don't have that sense of community, that sense of tribe, that sense of, hey, this is where I belong. We think that social media provides that for us, and it absolutely does not. And so I think it's some of that. We really, we got to be having block parties. We got to be going and knocking on our neighbor's door and meeting them, bring them a pie or something, These are the things that we've fallen away from really slowly since the 1950s, and then more quickly through the late 90s through today. We feel attached. We think we're attached to people. We think we have a sense of community, but it's not a real sense. I think that's a big part of it. But these debates go on with bigger brains than me, so it's a tough. What do you think, Paul? Why does this happen more?
I think you hit it on, and also, unfortunately, I think America does have a lot of evil, bad things on its at the roots. Be honest with you.
Absolutely.
At the roots of how this country was created, of roots of how we have done other people, other countries we have created. And I think God, the creator, has a way of balancing things. I'm not saying that suicide is the punishment, but I think we got guns, we got violence, it's a whole bunch of other stuff that goes on with America. And when it goes back to how this country is created and how it was invaded and tried to take out the Native American community, I think we have to really make atonement.
I think that's a big part of it too. I will agree with that, and you can really tell just how painful that is when people try to bring up the history of America, the reality of the history of America, and the backlash currently that's coming from that. Hey, if you cannot acknowledge that there was a genocide that occurred across this country in order to establish the country, and that a lot of the building of this country happened on the backs of people who had no freedom or were enslaved, if this is a simple acknowledgement, but when you look at television today and what's out there, and when you try to bring that subject up, man, that strikes a nerve. And today it's a raw one. And I do think that we have a history of violence. Suicide is a violent act. We're steeped in violence in our traditions and in our history. And I'm sure, Paul, there's a ton of people who would absolutely be screaming mad at both you and me for even talking this way right now. But it's true. It's true.
That's true. And that's what Bonita Threadgill just said. Dwight Harris has a question. How do suicide prevention work? What is it about?
How does suicide prevention work? Okay. The simplest thing that I can tell you, if I'm answering the question, if I understand the question correctly, the simplest thing I can tell you is when somebody is struggling or somebody is suffering or somebody is not feeling right, we normally know that, especially if it's family, if it's somebody we're close to, we can normally see this and we can sense it, right? And we know that a big percentage of the population, 11, 12, 15% of the population have seriously considered suicide at any given time. When somebody is struggling with a mental health concern, a lot of times we just think, well, you just need to work harder. You need to change the way your brain, you need to change the way you're thinking. And the reality is our brains aren't easily change. Our brain is an organ in the body that can malfunction. It can make us depressed. It can make us hear voices. It can make us anxious all the time. Our brain doesn't always work right. When somebody is struggling emotionally, they've lost somebody, they've divorced, a death, any kind of a traumatic experience occurs, and that person isn't feeling right, to step into that individual's suffering and say, I see that you are struggling and I'm here to help you. And I'm wondering if you're feeling so bad that you've had thoughts of taking your own life, or even as simple as saying, I wonder if you've ever had a thought where, hey, if I didn't wake up tomorrow, I'd be okay with that. And allowing that person to answer that question and you feeling comfortable asking the question too is a part of this. Because sometimes when people feel the way that you're feeling, right? If we say to them, sometimes when people feel like you're feeling, they have thoughts of taking their own life. Are you having thoughts like that? Just being able to ask that simple question, sometimes we believe that if we ask that question, we're planting the seed in people's brains, and we are not. They're either already thinking about suicide or they are not. So when you ask that question, if they answer the question and they say to you, no, I'm not there yet, I'm just feeling down, okay, maybe, right? We're going to trust they're going to tell us the truth. But if they answer that question, yes, then your next step is to say, I'm here with you. Let's get you to the help you need, right? This is about a brain not working correctly. This is not about a personality flaw. This is not about a personal deficit. This isn't about not praying hard enough. This is not about a weakness of character. This isn't about being cowardly. This is about a brain not working right chemically. And so we need to get them to the people who work with brains and help people get back on track. And so the simplest way that suicide prevention works is that we all get comfortable with the fact that 1 in 5 of us, pre-COVID, 1 in 5 of us is going to have a mental health crisis in any given year.
Wow.
If 1 in 5 of us is having a mental health crisis and we don't like talking about mental illness and mental health problems, we're not going to get very far, right? And we have to acknowledge that addiction is also a mental illness. No one wants to be addicted. No one wants to have a drug problem or an alcohol problem. Nobody grows up going, man, I can't wait till I grow up and I can be an alcoholic. And we need to recognize that these are brain issues that need help. And when we're willing to step into somebody's pain and their suffering and say, I'm here for you, I want to help you, will you go with me to get some help? Can I help you to get help? Those are the steps we have to take. And overwhelmingly, you will have a positive result if you can do that.
Wow. Thank you, guys. Ryan, anything before we go?
Yeah, just I guess to piggyback off that real quick, to answer Dwayne's question, I think it's pretty simple. It all begins with education. It's the education piece, and there's so many ways, Dwayne, in order to do so. You can contact Healthwest at any point in time, and we can give you trainings. We can give you any sort of like information, but it's being able to recognize the warning signs and having the ability or the capability or the want to ask those hard questions. Michael touched on it, but it's seriously sitting with someone in their moment and asking the hardest question, and then knowing the resources in the community. Figure out where your resources are. Where they are there. As many people, the fallacy of people believe that there aren't resources in the county, there are. There are people that can help. We just got to make sure you make the right numbers, make the right calls, and we can be there to help. So just education on seeing the warning signs, asking the right questions, and then getting into the right numbers. It's really basically simple.
Michael, thank you.
Appreciate it. Thank you, Paul. We're always here, and people can reach out to Healthwest, and hopefully we can continue our relationship moving forward, Paul. So I appreciate every opportunity.
Definitely have to. God bless you guys. Take care.
Take care now.